Hi, everyone. My name is Sarah Druce, and I'm part of the CSAIL Alliances team at MIT. I'd like to thank you for joining CSAIL and CSAIL Alliances member McDermott, Will, and Emery today for Public Health versus Privacy, the Technology of Contact Tracing. We're going to start off today with presentations from both CSAIL's Danny Weitzner, as well as McDermott, Will, and Emery's Laura Jehl, and then we're going to move into a panel discussion. So I'd first like to introduce Danny Weitzner, who is the founding director of the MIT Internet Policy Research Initiative, which collaborates with policymakers and technologists to improve the trustworthiness and effectiveness of interconnected digital systems like the internet. He's also a principal research scientist at MIT CSAIL and has served as the U.S. Deputy Chief Technology Officer for Internet Policy in the White House. So, Danny, please take it away.
Thank you, Sarah. And let me get my screen share going. Okay. Sarah, thank you. And thanks so much to our partners at McDermott, Will, and Emery. I'm really looking forward to the discussion with Laura, Barbara, Amanda, and Marco, the rest of the panel. I'm going to talk with you today about the very rapid rise of new features on our cell phones, automatic exposure notification that help us to detect when people have been in proximity with those who may be infected with COVID-19. And I'm going to highlight some of the work that we've done on the privacy aspects of this question, deployment challenges, and ultimately how to think about the risk equation that we're all entering into here. So this is the result of work that we've done at MIT, but with partners, as you can see, from really all around the world as part of a project called the PACT project, the Private Automated Contact Tracing Initiative. So I'm going to go over just the basics of the design of what became the Apple-Google exposure notification protocol that we all have on our phones. Let's talk about what we saw as the initial privacy requirements, and then a little bit about how deployment is going. In order to just set the stage, I want to remind everyone about the contact tracing landscape and some of the fundamentals, some of the public health fundamentals here that we're trying to meet. So consider this in representation of how the COVID-19 infection progresses. It starts with an index case. That's how public health officials refer to an individual who's infected. And as you can see in the top arrow, there's a period of time where, as we all now know, the individual is incubating, but not infectious. There's then a very important period of time where the index case is infectious, but has no symptoms. That is, they don't know that they actually have the disease, have the virus, and that they are susceptible to exposing others. Then, of course, they become infectious and hopefully recover. What we're interested in here is the question about what happens to individuals who come into contact with this index case. And what you can see here in the lower arrow is that there's a period of time that can be up to several days where the index case is pre-symptomatic but infectious, and where an individual may come into contact with that index case and get the infection. And the goal here is to identify those contacts as rapidly as possible, as completely as possible, and to then be able to encourage those contacts to take appropriate measures, whether it's get a test or quarantine or isolate themselves, and also to make sure that those individuals are taking advantage of public health resources that are available. Now, the way that we do this with many different infectious disease, the way that works is that public health get notifications when someone tests positive or has a positive indication for an infectious disease, and then talk to that individual and try to piece together where that person has been, who they've been in contact with, and figure out how to contact those contacts and make sure that they're taking the appropriate steps. This has been used in tuberculosis, in smallpox, in sexually transmitted diseases, and public health officials are really expert at doing this. But COVID-19 poses some very particular challenges in that there's a substantial period where the infected person is asymptomatic and doesn't know that they're spreading, and that spread can happen in many different circumstances, even with relatively casual contact. In response to this, a number of Asian countries, China, South Korea, Singapore, Taiwan, among others, realized that they had to be very aggressive about contact tracing and began to use a whole variety of interesting smartphone-based surveillance techniques that could help both identify who these contacts were, and also in some cases, as in Taiwan particularly, and China, to enforce quarantines when individuals were identified as being at risk. These countries used existing smartphone technologies that actually came from advertising, from location-based advertising, in order to both identify contacts and to be able to detect when someone might be violating a quarantine. These early techniques use GPS location-based tracking, so the result was that these governments, these public health authorities, had enormous databases of the movements of very large proportions of their population. Our feeling at MIT and with colleagues around the world was that this approach was going to be, in many cases, considered unacceptable and disproportionate in democratic societies. So we set about to look for whether there was a different way to use the most powerful features of smartphone technology in order to identify contacts without creating excessive surveillance systems. And we set out a set of goals. Number one, we wanted to figure out how to do proximity detection without using location information. What that means is that we realized, and others around the world realized, that really what mattered for the purpose of COVID exposure notification is to figure out whether you were in proximity with an infected individual. It didn't matter where that proximity was. All that matters is your relative location to that person. So the absolute location that GPS provides was not necessary. We wanted to be able to preserve the privacy of the infected person from everyone, including from public health authorities. We wanted to be able to preserve the privacy of contacts, those who were identified as being in proximity to an infected person, also from everyone. And we wanted to protect against false test results being injected into the system. In March of this year, as the pandemic was heating up, colleagues at MIT and then colleagues from really all over the world, a large group centered in Switzerland at EPFL and EPTH, began working on this problem. And by April, early April, we had both actually published designs of how to do exposure notification without location tracking that preserved all these privacy properties. Our protocol was published on April 8th. Apple and Google remarkably got together and announced that they were going to implement a system like this. They did that on April 10th, one of the most rapid cases of technology transfer I'm aware of. I want to just go over very briefly how this system worked. This was, again, technology that was designed at MIT by a number of our colleagues, also by other groups around the world, all of whom had very similar kinds of ideas. So this was really a collective effort. Imagine a situation in which these two individuals, we'll call them Alice and Bob, were in close proximity with each other, but they don't actually know each other. They might have been sitting on the same park bench together, or taking a train ride together, or something like that. Later on, Bob tests positive for COVID-19. Now, if Alice and Bob are both using an exposure notification app, what would be happening in the background is that their phones would be listening for very short little Bluetooth signals, the same technology that you use to pair your smartphone with a speaker or with headphones or with your car, is actually used in this case to record what other devices are in the area of your smartphone. Now, The way that this particular Bluetooth technology works is that the identifiers associated with these little chirps, these messages that go back and forth, actually change every 15 minutes. So there's a reduced risk of being able to identify the person nearby you, but you can still know what devices were around. So as this protocol is operating with either your iOS or your Android exposure notification system, each device is keeping a list of the chirps that it's heard. If Bob becomes infected, he can then choose to enter information about all of the chirps that he emitted during the relevant period of time with a database that's run by the Public Health Authority. Now, of course, Alice has no idea who Bob is, but she does, but her smartphone running the exposure notification protocol on a regular basis checks the list of all the chirps that were submitted by people like Bob that are identified as infected. And she checks that list, her app checks that list against a database that she keeps on her phone of all the chirps that she's heard. So if her app realizes that it has heard the infected chirps of Bob, she will get a notification. Now, it's important to point out here, going back to our privacy requirements, that this is a transaction that occurs entirely separate from the Public Health Authority. When a proximity alert is issued, Alice is encouraged to contact her Public Health Authority, given specific information about how to do that. But in our initial design, in the design from the Swiss group, and ultimately in the design that Apple and Google took up, we made the decision that we did not think it was smart from a privacy perspective to force Alice to identify herself to the contact tracing authorities. Some public health authorities consider this to be a mistake because they think they ought to be able to reach all these individuals who are potential contacts. The view that we had was that, frankly, this was such new technology and such an uncertain new kind of system. We wanted to be able to make the strongest privacy guarantees that we could make. In particular, we're very much aware of the fact, and we can see now in the experience of contact tracing, that there are many individuals, certain vulnerable populations, who feel at risk of various kinds of adverse consequences from being in contact with the government. They may not trust the government for one reason or another. This protocol is designed to make sure that even those individuals can be notified about the potential proximity to an infected person and then take steps that they think are appropriate. I will say, and I'm sure we'll talk about it, that was not the obvious privacy choice to make, and there's certainly reason to talk about whether it remains the right one, but that is the decision that was made very early on. And just to give you a picture to understand how this automatic exposure notification is connected to the overall public health process. This is really a notification protocol that works in parallel with the Public Health Authority's manual contact tracing activities. As I described, when individuals test positive, their contact information would go right to the Public Health Authority, and there would be a manual contact tracing effort that would begin with phone calls and such. In parallel to that, this automatic exposure notification protocol kicks in, assuming Bob, that is the infected individual, decides to share his information with the automatic exposure notification protocol. Again, we erred on the side of making sure this system was voluntary, making sure every single individual has complete control over what happens to their personal information. I do think it's worth thinking, though, about whether this is exactly the right privacy trade-off or not. let me say just a little bit about the adoption of this system. It's a moving target, first of all, and I'm actually going to share with you two different sources of data that give you a picture of how the adoption is going. At this point, over 40 countries and over 20 US states have adopted some version of the Apple-Google exposure notification protocol. This is one study done by colleagues in Ireland, Stephen Farrell, who's done some excellent independent research on this, and finds there's actually pretty wide variability in the actual usage of the Apple-Google exposure notification protocol by country, from a high of about a quarter of the population down to considerably lower numbers. In the US, there are a number of states that have begun to deploy this technology, but as you can see, there are many who still have not chosen to do that. I want to highlight data that I actually just received in the last week that gives you a picture of the deployment of the exposure notification system. This does not necessarily reflect how many people actually use the system, rather it reflects how many people have turned it on their smartphones. And one development that I want to highlight for you is that there are now two ways in the Apple-Google environment to use exposure notification. One is that you can download an app, and there are a number of app developers who have offered this service. Notably, in order to turn this service on in any state or jurisdiction, it must have the approval and be under the operating authority of the public health authority. So some of you may run or represent private sector organizations, employers, universities, others. And you may say, well, I would like to have this for my own population. Well, the way this has been set up, it actually has to be turned on for the entire public health jurisdiction. In most of the world, that means for the entire country. In the US, because we have a decentralized public health system, it means each state has to make a decision to turn it on. Just recently, Apple and Google have introduced, in addition to the exposure notification system that enables these apps, something called Exposure Notification Express, which is built into the operating system of iOS and will soon be built into the Android operating system. This is a kind of a zero install environment, which allows individuals in any state where the protocol has been turned on to just make a few selections in their operating system setting and right away have access to this exposure notification system. This is called Exposure Notification Express, or ENX, and it relieves the public health authorities of the burden of having to go out and get an app developed and have it deployed. What's really interesting is if you look at these recent statistics across the United States of selected states that have deployed exposure notification, you'll see these states in the green that have deployed recently that have actually much higher exposure deployment statistics, much higher usage statistics than other states that have had the apps for quite a while. So we do think that there's some evidence that making the deployment easier for a public health authority and for users, that is to just be able to turn it on with the click of a few buttons in your operating system rather than having to download an app and sign up for it, we think may account for some of the more rapid deployment, but that's something that's still being looked at. I want to just highlight a couple of adoption challenges, and I'm sure the panel will talk about this more. And this is a very technical slide, but I'll boil it down as follows. The way that the exposure notification protocol works, as I said, is through using the Bluetooth technology that we're all used to on our smartphones. The vast majority of smartphones have Bluetooth. And one of the really important things that Apple and Google did was to agree to work together so that their use of Bluetooth is actually interoperable. So that means that whether you have an Android or an iOS device, you'll be able to detect contacts nearby you. The way that the measurement works technically, remember the goal, at least in the US, is to identify people who have been within 6 feet of each other for more than 15 minutes. And the way that that's done is to measure the signal strength of the Bluetooth signal that goes back and forth. Radio waves, as you know, get weaker as they travel across distance. So in theory, you can, if you get a Bluetooth signal from another phone and it's 20 feet away, the signal is going to be weaker than if it's just 5 feet away. That's true in theory. The challenge is that Bluetooth and other radio waves travel differently through the air than they travel, for example, through our bodies. They don't actually travel through our bodies very well at all. So there's going to be a different signal strength measurement or apparent distance depending on one of two cases. If you and I are standing near each other and we both have our phones out in front of us, that's going to give one signal strength indication. If I happen to have my phone in my back pocket, the signal has to get all the way through my body or around my body to you, and it's going to look different. So there are still some challenges in measuring the actual signal strength, and the Apple-Google implementation has taken technical steps, which I think I won't describe in too much detail here, but basically to allow each public health jurisdiction to make determinations about whether to try to tune up the notification, that is to err on the side of having detecting more notifications, even if some of them may not be within the prescribed time and distance, or to collect fewer notifications, which would be more conservative, which wouldn't, but might miss certain medically relevant exposures. So this is something that's still under development and being studied, but we think things are going in a positive direction here. Before I end, I want to give you just a very concrete example of how deployments are going and what the actual efficacy is of any of these systems. I'll say just because ultimately what we care about in these systems is when they're deployed, do they actually detect medically significant exposures of someone who has tested positive for COVID-19, where those exposures might not have been detected through a traditional contact tracing process. If we can do that, then we're augmenting the existing contact tracing, manual contact tracing experience. If we can't do that, then we have to wonder about whether the system is working right. There's a wrinkle here, which is actually a privacy wrinkle, which is that in order to assure that the protocol was maximally privacy protective, it actually restricts the kinds of statistics that can be collected that would give us good indications of usage. So we're learning about how to actually study the impact of this protocol. Switzerland has done a large-scale study in the canton of Zurich, that is the area around Zurich. And the good news is that what they've found is that they actually are getting notifications of medically significant contacts, that there are a number of positive tests in which the individual who took the test indicated that the reason they took the test is because they got notified by their AEN protocol, and that 2% of the positive tests were actually due to these AEN notifications. 2% doesn't seem like a huge number, but if we can build on that, and if that can reduce the proportion of the population that is going around outside interacting with people, not knowing that they're positive, not knowing that they could be infecting people, then we're making progress. But I think there is still an ongoing question that we have to ask about how to decide that ongoing deployment is justified and how we can get proof of public health efficacy. So just to review, there are, I think, really fascinating questions about the privacy public health trade-off, and I'm sure Laura will address those and we'll talk about them on the panel. I think it's notable that the protocol, the Apple-Google protocol, is only available based on the authorization of public health authorities. So even though other institutions in society, universities as an example, or employers might like to use this technology, the decision was made that the privacy risks were too great, and the potential, frankly, for coercion was too great to put it in the hands of just anyone. So the decision was to make it contingent on authorization from the public health authority. And as we go, we obviously have to continue to look for evidence of public health efficacy. I'll just end on this note. We knew in March when we started this design effort, before Apple and Google had thought about doing this, that we needed to have all the possible tools in the toolkit to be able to respond to the COVID-19 pandemic. I don't think we actually knew in March. We didn't anticipate in March, even in working with public health officials, how long this pandemic would be with us. So we very quickly got technology design out there, and Apple and Google very quickly deployed it. And we're very confident about the privacy protections that it offers because it's based on very strong cryptography and we think very carefully vetted technology design. The longer term questions about how to use this responsibly and effectively are ones that we're going to be learning about. And just like all tools in medicine and in public health, we don't get instant answers on these questions. So I think we're going to be going through a process of both trying to get the most out of these systems that we can as quickly as possible and on as widespread a basis as possible, and also really studying how well they're working, what kinds of changes we ought to be making, either in their technical design or in the policies around their deployment. So I'll end with that and look forward to Laura's talk and to the panel discussion. Thanks very much.
Thank you so much, Danny. Now I'd like to introduce Laura Jehl, who is currently the Global Head of McDermott, Will & Emery's Privacy and Cybersecurity Practice. She has extensive experience identifying and mitigating privacy and data protection issues arising out of the collection, use, and storage of data, as well as the design of new business models, products, and technologies. Laura?
Thanks, and thanks, Danny, for that great talk and introduction. I come at this from the privacy side, and I think when when the pandemic first hit and we started thinking about contact tracing, I thought, clearly people are going to look at this trade-off between possible death, serious public health risk, serious personal health risk, and privacy, and they're going to say, okay, for this one, it's worth giving up a little bit of privacy, and that really kind of remarkably has not been the way this has played out, although I think, as Danny said, we're starting to see some momentum in a different direction. I sort of thought I'd walk through what the trade-offs are and what the sources of concern have been. So Laura, can you advance the slides, please? So, Danny was talking about a particular development of the particular Apple, Google technology that they're using, that MIT's developed. And that is a very widely adopted, as he said, at the state level or at a public health level in the US. But it's not the only model of contact tracing. There's really no total, pure what a digital contact tracing app might be or wearable. The CDC says that includes apps that do proximity tracing, which we've been talking about, but also case management and medical monitoring, which would involve different kinds of data and different kinds of privacy issues than just proximity tracking. When the pandemic hit, data protection regulators around the world, some of them more zealous than others, issued guidelines, all of which are somewhat different from each other as to what can and can't be done for digital tracing. And so there really hasn't been a single standard approach taken by developers and policymakers. Initially, there was really limited interoperability. I think that's beginning to change, particularly as these apps roll out on the state level. There are smartphone-based apps versus wearable devices. Each of them has sort of benefits and drawbacks. And I think this now says they've been released in more than 47 countries. I think Danny's slide said maybe 60. It's a moving target, clearly. But it was kind of slow with the rollout on the US side. And so that void got filled, or has been being filled, by private developers, by businesses trying to track their employee contacts within the workplace, by university campuses trying to keep students and faculty safe. So you kind of have a lot going on, and not just sort of one model, which I think is, you know, a significant contributor to concerns about privacy, because it's a moving target. So, you know, I think this is, you know, as Danny said, set it up. The trade-offs in designing any of these are accuracy. You know, Bluetooth gives a certain level of proximity tracing. Geolocation tells you more information. If you use geolocation, you know where you were when you encountered somebody. You might then know whether you were wearing a mask or whether you were outdoors, other mitigating factors. But geolocation is a source generator of lots and lots of very precise and very sensitive data about movements of vast numbers of people if they use this technology. There are concerns, obviously, about false positives in whether if you're using Bluetooth, are you on opposite sides of a wall in a dorm room, or something like that that might, again, mitigate your exposure. Efficacy, you know, it only works if lots of people use it. If barely anybody adopts it, you're not going to get lots of significant notifications. Interoperability was a concern. I live in DC, which I'll remind you from Danny's slides is the jurisdiction with the highest uptake of using this device. We're super rule followers around here. We all wear masks and download everything the government tells us to do, which may or may not be a good idea, but that's how it goes. But where I live, you can be in Maryland in half a mile. You could, if you had an ambitious jog, be in Virginia too. And for a while, those technologies weren't interoperable. So if I went for a run, I could come into contact with, I don't know how many people that wouldn't have been picked up. So that was a significant issue as you think about how to design these technologies. And then privacy. What data is being collected? Is it identifiable data about an individual? Has it been de-identified, which means it's capable of being re-identified, or is it anonymized? Each of those, you know, has their privacy implications, but there are also implications about the quality of the data that's collected and the quality of the information it gives back. Where's that data going? Is it going to a centralized database like a public health authority or a big tech company who's managing the back end of it? Or is it decentralized where it's only pinging off your phone and giving you alerts on your phone, but there's no big pool of data being collected anywhere? Who's getting that data? Is it a public health agency? That's one set of concerns. If it's big tech companies, how might they use that data? What about your employer? How might they use that data? How secure is this database in which it's being held? Is it vulnerable to being hacked or otherwise tampered with? How about encryption? Is it securely encrypted? Danny talked about the data protection that's incorporated into the Apple Google model. But if lots of people and employers and individual businesses are building their own answers here, are they using those same protections? So all those issues, play into the privacy debate. And then once you've got a pool of data, how can it be used? Are there legal or ethical restrictions on what happens to that data? And by the way, if you think about phones pinging off each other all day, it's a mountain of data. It's sort of exponentially growing. If you're keeping it in one place, how long do you keep it? I mean, if it's only for contact tracing for a virus with a limited, essentially, shelf life of contagion, are you just sort of getting rid of it as you go? Or is it being kept that might be valuable data for research or for other purposes down the line? But where's that spelled out? There's a little toggle on your iPhone now or on your Android phone where you can turn on these kinds of technologies, at least those. But whenever someone asks you to use one of these technologies, what are the rules? Where's the privacy policy? Where's the law? And those are some of the concerns that are driving, the privacy side of this debate. So, what are the privacy issues, right? Why now? In a way, it seems kind of crazy, right? Because we've all been walking around with these phones in our hands, in our pockets. Pre-pandemic, we were all taking Uber everywhere and using Waze and having our geolocation tracked by really countless entities. It's kind of, whether it's through pinging off cell phone towers or anything else. So why is everybody so suddenly concerned about this? We were, a couple of things are going on. Immediately pre-pandemic, there was a surge in privacy concerns sort of worldwide. The passage of new privacy laws, GDPR in Europe, CCPA in California, and there was this sort of movement towards greater privacy and people realizing, and there are more and more stories, particularly stories about kind of the convergence of technology and health that were concerning people, because people had sort of thought, okay, any data about health, that's always protected by HIPAA, right? And no one can ever find out about it, it's super private. That's not really true, never was really true. But that's sort of the place in which we found ourselves in February and March. And then, when COVID appeared, I think there was an assumption, wait a minute, this sounds really serious. People are going to be willing to give up some privacy in order to protect themselves and their families and their friends. And it just didn't initially play out that way in the US. And it really had to do with issues of trust. So a successful public health response requires widespread adoption of the technology, for the technology to be any useful. But widespread adoption requires people to trust it. And trust requires transparency about what's being collected, how it's being used, who it's shared with, how it's stored, how long it's around. And there was a lot of confusion, especially about smartphone-based technologies, because everybody knew your smartphone can track you. And so the assumption was that must be how this is working. There wasn't kind of crisp messaging about these issues, mostly because the initial use cases came out of Asia, as Danny talked about, where they were being used much more aggressively for things like tracking movements of people who should have been quarantined, sort of a cross between a contact tracing app and a like ankle bracelet like you wear here to stay home. So, Americans were rightly concerned about that. And then we have a bunch of other distrust going on, whether, how the data will be used by whoever's collecting it. And then we got a bunch of distrust about just how bad the, COVID was in the first place, and whether these formally kind of trustworthy sources were really, giving people the right news. Was it really a hoax? And that decreased the apparent urgency of the adoption, and then increased sort of as people did the trade-off between privacy and urgency, they kind of veered in the other direction. So the other concerns that people have had really are, what's going to happen with this data? Will it be mined? Will it be used to advertise to me? Will I suddenly be getting advertisements for Advil and thermometers? Because that's how we're used to our data being used on the back end and things showing up, clearly having mined our data. Civil rights concerns really started to play in, again, because of the convergence of timing between these apps being released and, for example, the Black Lives Matter protests that happened in the spring and early summer. That's right when these technologies are rolling out, and it's right at sort of a height of distrust of law enforcement, government agencies. It suddenly seemed like a bad time to be carrying around a device that was tracking your contacts for a lot of people. And the bottom line is the US privacy laws don't, on their face, provide a lot of meaningful protections for collection of this kind of data. They're not, the default isn't that the data is protected. It's likely not subject to HIPAA because it's generally not collected in a patient-provider context. In Europe, it is subject to the European GDPR, the General Data Protection Regulation, and that's given some greater protections as to how it's used. California, at the state level, there may be some protections, although a lot of, but they require some greater transparency about how the data is going to be used, but otherwise they don't provide really great legal protection that says it can't be used for certain purposes. So, that's another reason to kind of spur privacy concerns. In response, there were a whole bunch of laws proposed, both on the federal and state level, both from Democrats and Republicans. Of all these, a lot of these laws were aimed, or legislation, I should say, not laws, were aimed at providing protections about how the data could be used and who it could be accessed by and whether it could be collected voluntarily or involuntarily. With the exception of the Kansas legislation, none of them passed. They were all proposed in the spring. Then kind of nobody was using these, or very few people were using these contact tracing apps in the US, and it kind of fell by the wayside. It was a presidential election year. Nobody really did anything about this, which means the data is being collected and there isn't a federal set of rules about how it's protected. Kansas passed a law saying that contact tracing information has to be limited, it has to be confidential, it can be made available to the government only through agreement of all parties or through a warrant, and it's got to be destroyed as soon as it's no longer needed. Participation in using the Kansas State app is completely voluntary, and there's the use of geolocation data is prohibited. So that's an example of how one of these laws might make people more comfortable, but unless you're in Kansas, you don't have that protection right now. I think we can go kind of quickly through, these are the Danny kind of covered some of this, maximally invasive approaches in Asia particularly, the minimally invasive approach, which is really the Apple-Google approach here, that collect minimal personal information and don't use geolocation. And then you have this middle ground, and that's where you find a lot of the sort of do-it-yourself contact tracing apps that businesses have been building to deal with exposure in the workplace, that universities and others are pioneering, trying to keep track of their students. And that's a real hodgepodge of approaches, and they may be used to supplement manual contact tracing. But they do typically collect geolocation information, and that, again, spurs some privacy concerns. I think we can kind of skip through some of these because we didn't cover them. In fact, I have the same picture, which you guys have seen before, about the minimally invasive approach. And the middle ground approach, again, they're really diverse. So they tend to be characterized by the collection of geolocation information. They often have a centralized approach to the collection of data. Some of them hopefully have automatic deletion of kinds of data so that you don't have just an unlimited database. But they collect all sorts of different kinds of data, and some of them are now expanding. I think we'll talk about this with the panel, to different kinds of use cases, including monitoring of things like vaccines and symptoms and things like that. And then they may be all over the map in terms of data security and encryption approaches. So I think, Danny covered some of this stuff. The rollout of the Express version, where the states didn't have to build an app, didn't have to be early adopters of untested technology, didn't have to take some of the privacy flack. It's made it much easier, and so now we're getting much greater adoption. California, which is now in its second lockdown of the year, is finally launching its app. I think they launched yesterday. I saw both Gavin Newsom and Tim Cook tweeting about it, and they promise it's 100% private and secure, which is a pretty good promise. You don't see 100% private and secure very often, so I hope that they're right. And those apps are beginning to be increasingly interoperable. So about 20 states said, forget it, we're not going to do it. And that may have been, and it'll be interesting to see whether they stick with that now that this Express version is available, and where that breaks down, given the sort of politicization of these issues, and whether it's sort of a political statement or whether it's a statement that they don't think this technology is appropriate or useful or whatever it is whatever the objection may be. That leaves these technologies that are marketed for use all over the place. So you see companies like Salesforce and PwC and GlaxoSmithKline, universities. The UC in California just piloted the app that's now going to be California's app across multiple campuses. Got the students to test it out. And then you've got things like BioButton, which is a wearable that one university was proposing to make mandatory for its students. That generated a lot of pushback, and they withdrew that proposal. But these are sort of on a micro level, and those raise issues, particularly if they're in the workplace. They raise issues of employer level privacy and employee surveillance laws. you can have, basically the law is you can have your employees wear them while they're at work, but not while they're not, which limits, again, the efficacy of these, those use cases. I think we can kind of skip some of the global stuff. I think Danny did talk a lot about it. We have seen both, again, privacy and human rights concerns around the world. The UK rule went out that actually didn't work, which created some concerns about, well, it failed to flag things. It wasn't carefully calibrated for some changes in research about how the virus spreads. And so these failures exacerbate distrust and exacerbate concerns about privacy. But countries like Germany and France are actually doing more around privacy, which seems to be helping their adoption. So finally, I just kind of finish up with general privacy and policy concerns. The lack of a uniform national approach, has created this kind of ability for rumors to spread just about, how privacy invasive these things may be, and concerns about, interoperability and efficacy. The most vulnerable populations to COVID don't have much lower smartphone usage and low adoption rates for these technologies. The convergence of the timing with the Black Lives Matter protests and movement, and concerns about law enforcement and about surveillance in general were really, strong disincentives and raised concerns about privacy and strong disincentives for adoption among a number of people. North Dakota decided to create its own app. They used it based on one that was for helping find your fellow North Dakota fans at the football game. If you were on a road trip and you wanted to know who was near you on the highway, they used that app, which was clearly not built for sharing private health information. Turned out that it was sending the back-end location information to Foursquare. That caused a fairly significant backlash. And the more privacy-focused apps might not be as helpful for tracking exposures. Bluetooth is not always highly accurate. So this is, even with Bluetooth, there are these privacy questions that remain, including things like how to verify the users tested positive. Frequent sharing of diagnosis key can lead to linkage attacks, where you can end up linking who the data is coming from, even if it comes in a de-identified way. We talked a little bit about security. And then finally, the workplace use really raises all sorts of other legal and privacy issues that have to be grappled with if it's a workplace-only technology. And I'll stop there and then look forward to discussing this with the panel.
Thank you so much, Laura. Now, Danny and Laura will be joined by Amanda Slady and Marco Vukolich for a panel discussion. So Amanda is currently CEO of Vital Circle, a B2B application providing data and analytics to employers and organizations to mitigate current or future risk of COVID-19 exposure. Marco is currently a research staff member in the Blockchain Security and Applications Group at IBM Research Europe. His research interests lie in the broad area of distributed systems. This panel discussion will be moderated by Barbara L'Italian. Barbara is a former Massachusetts state senator and now serves as a senior government affairs advisor at Partners in Health, a nonprofit global health organization that fights social injustice by bringing the benefits of modern medical science to the most vulnerable communities around the world. During the panel, if you have any questions, please feel free to send them to Barbara in the chat function here on Zoom, and she'll propose them during the panel discussion. So please take it away, Barbara.
Thank you, Sarah. Good morning, everyone. I'd like to just start by saying that, my background for the last 6 months prior to becoming the Senior Government Affairs Advisor was to actually do the really old school contact tracing that was being done by Partners in Health, acting as a backstop to the public health network here in Massachusetts. And the limits of what we did in terms of technology were simply if we had access to someone's cell phone and they had tested positive, we could send them an SMS text message. So clearly we were limited in terms of that. I see all of these as tools in a tool belt to try to reach as many people as possible and give them the proper information to be able to safely manage. Just a quick update, in terms of Massachusetts, they actually are actively pursuing these options. Last week was a deadline to apply into the Department of Public Health with notifications that are going to hit this week. Presentations are going to be made in 3 different areas. One would be working with the Google and Apple platform to build out a program to augment what's happening here in Mass. Another option is a pilot using your own third-party application. And then the third request that went out was to look into a deep dive into privacy and security concerns. Those won't start until January. They don't expect to have them completed until the end of February. So Massachusetts may not be on the map right now, but they're making their way towards that. And so that's just a little bit about Massachusetts. I thought we would start with giving Amanda an opportunity to give a quick overview of her company and perhaps to give a couple of examples, if she doesn't mind, about her product and how she, in particular, her company is mitigating risk and trying to manage privacy concerns.
Great, thanks, Barbara. So Vital Circle, is a startup. We, as I jokingly always say, COVID is a startup, so is Vital Circle. We came onto market really initially to help family and friends, and then it really exploded from there. And helping individuals to, track their daily symptoms with regard to COVID. So, keeping track of how you're feeling over time. As we know, you may not feel well today, but you didn't think about the time that you didn't feel well 3 days ago because you haven't really, nobody's keeping a wellness journal that I know of. And so we really look at COVID as a way of, tracking the symptoms. And then on top of that, doing what we call Bluetooth or non-GPS, non-biometric contact tracing. So I know that Laura and Daniel talked about this. We are actually using a technology that's a separate wearable device. So it's not in any way connected to your cell phone. And so for us, we've actually, implemented this out in large employer groups, manufacturing plants, and large events. So we've actually been doing some, large in-person events during the pandemic time. And the big thing that we're getting from participants, and really why we looked at more of a Bluetooth technology instead of a geo-tracker or biometric tracking, technology, is that, people are, as Laura and Daniel said, concerned about privacy. They're concerned about who's got the data about who they've been around or where they've been. Or even, what their body temperature is or their resting heart rate. And so we really believe that, and Laura had said this, but we really believe that, it has nothing to do with about where the contact happens. It has everything to do about when the contact happened and being able to record, when contact happens between the 2 individuals.
And I do want to give the other members of the panel, if they want, the opportunity to ask any questions of a panel member, given that you all are the experts on this and I'm learning. So if there are any questions thus far that were spawned by what Amanda said, please feel free. Okay, hearing none. I am going to now.
Maybe one question. So given that you go to wearables, and so why Bluetooth? I mean, Bluetooth is a logical choice in smartphones because it's there, but why Bluetooth for wearables?
Well, so for us, it was, Bluetooth between devices. The majority of the clients that we're working with and employers are situations, manufacturing plants where individuals can't have their cell phone on them. Also the fact that, we can do device-to-device connection, and really we're just identifying the devices by their unique identifier number, not by a specific name or individual.
So can you talk just a little bit about what the data is exactly that you're collecting about people? Is it just,
Sure.
is it just contacts, or are you collecting other information as well?
Right, so we are just collecting contacts. So for our devices, what they're doing is device-to-device connectivity. So basically what it would record is if Laura and I were wearing devices, it would record, today, which is December 8th. I had to look at my calendar because it was, COVID brain, you can never remember what the date is. But it's December 8th. So if we were in the same room together from 10 to 11 a.m. Central Time, so 60 minutes, Amanda and Laura, it wouldn't be by our names, it would be our device numbers, but device A and device B are together on a date at a, for a certain amount of time, so 60 minutes at an approximate distance of 4 feet. And so then basically what we're able to do with that data is when, say, device A comes up as symptomatic or COVID positive, we can mitigate the risk of continued spread of COVID within a population, or, whether that's symptomatic, asymptomatic, symptoms, or a COVID positive individual. And we can identify anybody that they've come in contact with over a certain amount of dates. So we can look back to the day that they started wearing the device, or we can say, Amanda's device, if she's device A, started to feel symptomatic today on the 8th. So let's look back at all of the contacts she's had. So significant contacts, which, in CDC world is, 15 minutes at 6 feet or less. So we could look at all the contacts of 15 minutes of cumulative time over a date range at 6 feet or less.
Okay, so there was one question in the chat that mentioned this exact thing around the 15 minutes, that it's cumulative time. Doesn't have to be consecutive time. So you're saying that you address that.
Exactly. So we're looking at, cumulative amount of time over a specific amount of dates.
Thank you. Okay, I wanted to give Marco a chance as well to talk about his extensive work with IBM. My understanding is that he works on the Google and Apple platforms, but also with a French Robert-based approach as well. And so I wanted you to talk a little bit as well around your approach to privacy and data security and what makes the work that IBM is doing unique.
Yep. So thank you, Barbara. We started pretty early in contact tracing in IBM, and basically I remember in late March, early April discussions with the MIT PACT and of course with DP3T. IBM Zurich is in Switzerland, so we have really tight connections with EPFL in ETH. So we thought about developing our own protocols, but basically what's really important in this use case is interoperability and having a sort of standard. So basically with positioning of Google and Apple to deploy one such a protocol based on Bluetooth, this was basically very important for like future interoperability, although it doesn't solve it. And basically we were happy with the way this was going with MIT PACT and DP3T. And essentially we continued, instead of inventing new things, we continued supporting these protocols from day one. We work on different technologies. So basically my question directed to Amanda was related to, would you want to use Bluetooth necessarily if you are supposed to, for example, design an Android or iOS phone from scratch? Because there are technologies that are more amenable to precision, like distance measurements, such as ultra-wideband radio or some others. So we are working on that. But we are also, especially what concerns my work is relating to interoperability of mostly Google, Apple exposure notification systems, but also to a certain extent with some considerably different designs, such as what you mentioned, Barbara, Robert in France, which is like what falls into the category of decentralized contact tracing systems. So exploring what kind of interoperability is important there. Actually is possible there. So for interoperability on Google Apple, for Google Apple frameworks, it's important to note that even if like all parameters of devices would be tuned exactly in the same way, you still have an important question of backend interoperability, which is related to scalability. And like, would you, for example, in international, once we go back to old normal, I would say, if you travel from US to Switzerland for vacation, like how would your COVID app based on Google Apple framework work and interoperate with Swiss COVID app based on Google Apple, right? Whom do you report the diagnosis keys? So basically these keys that essentially Daniel talked about, that are exchanged between the devices and so on. So this is mostly what I'm concerned with. And recently, we have an effort in the context of European Telecommunication Standards Institute to, it's a bit of not very nice task of standardizing something that has a de facto standard like Google and Apple exposure notification, but in which we are trying to address basically standardization of these questions that are not stressed enough, such as interoperability. So basically my work in the contact tracing I'm originally I'm electrical engineer, so but most recently working on blockchain and decentralized networks. So in this case, for me, I'm looking at all this network of backend servers in each and every country and region as basically an entity in a huge decentralized network, which is essentially governed by individual jurisdictions, right? And how they can interoperate together is what I'm looking at.
Great, thank you. Just going to quickly go back to a question in the chat that related to the 15 minutes. Someone wanted to know if you were to hug a non-infected person sandwiched within the 15-minute contact window, and then they parted quickly, would an interaction with an infected person notification take place?
So maybe I could take that. I think that there's two 15-minute intervals here that are relevant, but they're not related. That may have caused the confusion. The identifiers for these Bluetooth chirps that go back and forth change every 15 minutes. That is different from the 15 minutes, which is the CDC contact window. The way that the Apple-Google protocol works is to try to figure out, based on all the chirps that you've heard, have you spent more than a total of 15 minutes with one individual who's infected or not? So the answer is, if you just, I don't want to opine on the question of whether hugging someone is a medically significant contact or not, but it would not trigger if it was just a momentary, unless it was a 15-minute long hug or part of some other interaction with that person, it wouldn't generate a notification.
Okay, thank you. I want to just ask anyone to comment on this notion of concern around privacy. I'd read that in Nevada, the reaction, the uptake was about 3% to their app. And I know some folks have real concerns around data mining. And so I'm just curious for all of you, what you feel we can do to allay those concerns, and how do we find a balance? And I know this is being used right now in some schools. It's being used in workplaces. Some professional teams are using this. So, you know, how do we combat this issue of non-compliance in a day and age when there is such distrust of the CDC, distrust of public health measures? We've got the highest levels of government mocking public health prevention. So what kind of challenges do you think this presents? And I guess with this, does it connote then that and I think Laura alluded to this, are there certain segments of society that are probably never going to participate in this because of access to, you know, access to the proper technology? Even, you know, I think of Western Mass that doesn't even have decent last mile, you know, so whole bunch of questions there just to get this going.
So I'll bite on the privacy stuff. I think the biggest issue has been that there hasn't been sort of one national solution. If you look at, you know, and Dan talked about that this is not the way we do public health in the US, but if you're the UK, I mean, they did have a hiccup, but if you roll out one app across the country and you can disclose what it does and what the privacy protections are, and particularly if you're in Europe where you have a significant and strong privacy law in GDPR, you can get people more comfortable. The problem here is both that we've had this crazy patchwork of essentially sort of do-it-yourself solutions and a low adoption of the Google Apple model, which I think everybody was pretty surprised about. They spent a lot of time and effort trying to make a privacy protective solution, and it wasn't adopted. All of these sort of one-off solutions around, you know, universities or employers arose, and each of them operates differently. So it's hard to get sort of a widespread sense of confidence in privacy. You need to have transparent disclosures about what is this one doing? You know, does it collect in a centralized way? Is it identifiable? What happens to it later? Those questions. And I think because people aren't used to having to delve into, reading privacy policy and everything else, they just get overwhelmed and opt out and say, this just seems like I don't want to do it. And so we have to find a way to explain to people what the privacy issues really are so that they can make informed judgments as to whether they want to opt in. But they're sort of overwhelmed by lots of different solutions, some misinformation, everything else, and that just causes people to opt out.
So we spent a lot of time in my group studying people's privacy reactions to different kinds of apps, different kinds of services. We're at the very beginning of being able to learn how people actually respond to these particular kinds of apps because they're new. One of the things that I think is just generally true, and this really speaks to Laura's question about what it is that people know, is that I think people are actually pretty practical about these questions. I think they make risk-reward trade-offs. They may not be perfect. They may not be perfectly informed, but I think lots of people do make those kinds of judgments. They may not make them on perfect information, but they make them on the information they have. And part of the reason that I think, we've always emphasized the critical role of public health authorities is that, I wouldn't disagree with anything anyone has said about the level of trust or distrust, but it is also the case in the United States that I think an unprecedented number of people have basically followed instructions from public health authorities, which is extraordinary. And now, obviously, we would like more people to follow them more carefully. But what I've learned from working with people in public health is that there's no perfect solution to anything. There's no sin. Barbara can speak to this, I'm sure. There's no single technology. There's no single drug. There's no single social intervention. There's no single anything. And because people are different and people have different vulnerabilities and different values and different perceptions. And I think that, to me, the critical equation here is the risk-utility equation. The more we can show people that these systems actually work, I think the more they will adopt them. Do we need to convince them of their privacy properties? Absolutely. But I think that has to come along with the sense that there'll be some value. All you have to do to believe that is to look at the trends in social networking usage. All the time that big platforms like Facebook and others have been trashed in the press and sued and fined billions of dollars and all kinds of stuff, the usage numbers continue to go up because people get value from them. And I think we have to take a kind of a similar attitude here, that people need value. Now, I think where privacy protection is really critical is for vulnerable populations, is for people who might be subject to coercion by their employers. As Laura said, a lot of the legislation, interestingly, is targeted at employer and other private sector uses of this data. Essentially, none of it is targeted at the public health authorities, which is interesting. There are a couple exceptions, but not many. So anyway, I think that part of what we have here is a gap between being able to deploy technology really quickly and efficiently, and I think carefully, and a more complicated kind of social diffusion of how it's understood and the sense that people get of its value, which just inherently takes time.
I would just respond to that and say, I think you're exactly right. And I think I was trying to get at some of that risk-reward balance. And when I was talking, I think one thing that's skewed it has been that, to my mind, the perception of risk has been substantially skewed for a lot of people. There are a whole bunch of people running around not wearing masks and saying this is a hoax. Those people, the trade-off between adopting something that's privacy invasive, if they don't think they're getting any public health benefit, if they think that they're not at risk of a dread disease, then why trade your privacy? the reason you would trade privacy or make some privacy trade-offs is that you think you're getting some significant benefit of protection for your health or your family's health or somebody's health. And I think that's where it gets skewed. It's not so much that privacy is overweighted. It may be that in some cases risk, the benefit is underrated. At least that's my assumption.
Is there any sense that this is, again, a piece of technology that would be most likely used by young people? You know, are there any groups that we think would be less likely right off the bat? I guess, Laura, you gave an example of someone who doesn't believe we're in a pandemic and doesn't believe this is a public health risk, but are there groups that could potentially be left behind in relying on these apps? In other words, in states that are not actually deploying the personal touch with contact tracing. So just curious if there were any assumptions made that certain groups probably would be tougher to reach and would be less apt to use these apps.
Yeah, I mean, for us, I mean, our focus has really been on manufacturing and employers and those groups. And what we've really found is, again, Laura kind of alluded to this, and I don't want to get into a political conversation or anything like that, or even specific numbers, but there is a large amount of people who believe this is a hoax, who believe the virus doesn't actually exist, aren't wearing masks, aren't social distancing. So you add on top of that, the government, because anybody who's tracking them is the government, but the government wants to now track your contacts. So there's a whole subset of just the United States population that is focused there. The other thing for us, which is what we've really come across in talking with our clients, is there's, number one, the privacy concerns with, do I want my employer to know where I'm going? So, the lack of having the lack of geo tracking. Also them, not wanting to have biometric data connected to any of the devices that they're wearing, which is one of the things that, Oakland University, brought up with, and Laura talked about this, but the bio button, and so not wanting geo tracking, not wanting the biometrics. But the other thing is there's a whole population of individuals within the United States, outside of the United States, who don't have smartphones. Mm-hmm. And so those people, don't have the ability to have apps. I mean, if we think about, individuals who are still buying, cell phones and they're buying minutes, those are not people who are going to have an Apple or Google, or Apple iOS, app that's going to be able to be used for tracking.
Amanda and others, can we talk a little bit about wearables and their use in the workplace and in schools? Can we talk a little bit about some of that, where maybe some of this success has happened?
Yeah, I mean, so the success for us, I mean, when you look at schools, we know in America, most, high school students by now have a cell phone. I have a 6-year-old niece who is, still dying to get her own cell phone. But there is still a need, from, kindergarten or preschool up to high school age to be tracking contacts within schools. So using a separate device, not a cell phone based device, is going to be ideal for those situations, because you're looking at, what are the contacts that the kids are having, the administrators, the teachers, even, the lunch person, who's typically not a district employee. So you want to look at those kind of connections, and having a wearable device makes that very easy to do, and is, doesn't rely on having a smartphone. For us, manufacturing is another big, area for us. Even healthcare is another huge area for us, because it's industries where individuals can't, either number one, can't have their cell phone on them because their employer is mandated. When you're down on the floor or on the assembly line, we don't want you to have your cell phone in your hand because something could happen. So, for us, our devices are small, and unobtrusive into daily life, that people can wear those, on the plant floor and be recording the interactions. And so that's really for us where we've seen a huge amount of uptake in, people wanting to implement these technologies in their workforces. And for us, manufacturing is a huge, there's a whole downstream effect to that. I mean, we saw how, early in the pandemic, the pork and poultry industry got hit really hard with COVID. A pound of bacon went up to like $10, a pound. And so there is, you know, a downstream financial effect if we're not looking at the industries that we need to keep and are considered essential to keep, you know, America and the world running.
So can
I think
ask?
oh, sorry.
No, go ahead, Dan.
Sorry. You know, so I think the equity economics of this is all complicated. It is true that poorer people have lower cell phone adoptions rates, but still have pretty high cell phone adoption. And by the way, have more cell phones than they have landline phones. So the cell phone and the smartphone remains, you know, a critical way to reach people. I would also say that there are what we know is that there are vulnerable populations who won't answer contact tracing calls because they're worried it's from the government. I would suspect those same, and some of those populations are not going to necessarily have employers who can spring for the cost of Amanda's device, which is a great device. So I think we have to figure out how we get maximum coverage across the board. You know, over 90% of the adult population has smartphones, and we gotta leverage that somehow or another. I would also say that, you know, part of the reason that I think both state legislatures and the U.S. Congress is looking carefully at employer uses of these technologies is because they have real consequences for employers. If you come into, I don't know, Amanda, what happens when someone who's a worker who has one of your devices gets a positive contact. My guess is that has some implications for their work situation. I would hope it would, otherwise, right? But you know, we see this all over. We see this in universities. We see it in lots of different employment situations. People who are at the low end of the income spectrum face really dire consequences if they're identified as a positive contact. And so we have to, I think, be extra careful about fairness and accuracy and all that there.
And I think that's, go ahead.
No, I was just going to say, as a policymaker, I would hope that any corporation that's purchasing these devices, if they find someone's positive, they are then going to allow them to go home and safely isolate, safely quarantine, and pay them while they're not working. As a policymaker, to me, that's critically important as well. I would think if you're putting that kind of investment into your workforce, then you know, to know this is happening, then you need to kind of manage the other end of it. Just as I feel in contact tracing, it's not just about contact tracing and reaching out to people, but it's what do you do to help people safely isolate and quarantine at home? What we do here in Massachusetts, and it's a model going out throughout the country, is what's called care resource coordination. So you're not just doing managing, and it's what the CDC was talking about. It's not just alerting people, but it's helping provide what they need to be able to safely abide by the rules and the isolation and the quarantine.
I think it's worth thinking too about workplace-based solutions. What are they intended to do? What is the benefit of them? I think Amanda talked about, you know, keeping manufacturing plants open, and certainly we have clients both in manufacturing and in the healthcare industry, where in the beginning, if you were there was anybody tested positive, everybody left and went to quarantine because they didn't know about, you know, how closely they've been exposed, and that left a lot of businesses very short-staffed. But some of the other questions that employers are looking to do is to be able to protect themselves against things like OSHA claims that they are having a hazardous workplace, and to be able to say, look, although we had 7 positive tests, these people all worked in different buildings, so they didn't come in contact with us. They were not exposed here. Those are benefits, you know, for the employer. But if it's employment-based, you know, wearables or contact tracing, that kind of has to stop at the employer's edge. I mean, when you leave the office or the hospital or the meatpacking plant, your wearable should either be turned off or left, because there are employer surveillance laws that prohibit employers from tracking information about you collected, you know, when you're not at work. Particularly if it's something like using a geolocation system, but even with the Bluetooth, there's some challenges around that. So, one question, you've got sort of general public health protective technologies. Again, the Google Apple model, the sort of state public health issued models, but then these technologies that are used for other purposes, it bears thinking about whose benefit, what's the purpose, what is it, what are we achieving with these technologies, and is it really, purely a public health issue, or are there other values, coming into play?
I just add one point to that. I think it's such an important point that one of the things I think that we're all learning about the state of public health investment in the US is that it is radically underfunded. And the result of that is that there's burden on employers to do things that probably government public health authorities ought to be doing, and would do it, frankly, with more accountability. Even the development of these very technologies, which I think is, wonderful and exciting, and we were very happy to be able to contribute to it. It's sort of striking that it's all happened with governments kind of chasing it at the back end, as opposed to having initiated it or encouraged it. We were neither encouraged nor discouraged, frankly. And Apple and Google can speak to themselves, for themselves about that. But it is, I think something that we all have to really think about is, do we have the right allocation of kind of public roles and private roles here? I know lots of large employers who face these really challenging questions of the sorts that Laura's talking about. Are you creating a safe workplace or not? How do you do it? And we should think a little bit about obviously employers have to create safe workplaces, but if too much of the burden falls to employers to do that, we get something that's other than a kind of a genuine public health response. We get something else. So I think that's a lesson. My guess is that we will learn and apply the next time, but it really bears paying attention to.
So Danny, following that up, is there a role to be played with a new administration coming in January? We're a free marketplace society, so I don't think we could have necessarily chosen one way of doing this. I think many ways would have crept up because people want to figure this out. But do you feel there's a role to be played in the new administration, either through funding for this or through vigorous, scrutiny of privacy and all of that, and where all this goes once the pandemic is over? Because that's a question someone has, is what happens after this is over? What do we do with this technology?
I think, without a doubt, I think there's, I would hope the next administration will take a more forward-leaning approach on all of these questions. I will say some of our research now is being funded by CDC, and they are working hard now to help states figure out how to deploy these technologies responsibly and effectively, and I think that's terrific. But I think we need a much broader response. And some of the privacy trade-offs that we have, to be candid, essentially been made by a bunch of technology designers with the assistance of a few smart people in public health. And we should probably take a broader look at that and figure out what's really the right approach here. I think you're right, Barbara, that we're not going to have government designed Bluetooth protocols, I wouldn't think, and I wouldn't hope, but setting broad direction about where this fits in the overall public health response, I think is vital.
And
so
potential.
If I may add something, because I'm not contributing much, because there are a lot of US specific things, so I'm not neither US citizen nor do I live in the US. But I think what administration could do is help educate people, because it's easy to think that this is a GPS surveillance or massive surveillance technology, which it is not, and it's a huge step compared to what we had deployable in February this year on this planet. This is a huge step forward. It might not solve all the issues that we have currently, but for the next epidemic, or if this hopefully not lasts not too long, we'll be more ready. But what the governments could help is educate people that this is not, basically, that if governments would want to do mass surveillance, this would not be necessarily the technology of their choice, because it's not really meant for that.
Yeah,
So
I
much
mean, I
better.
would agree with Marco. I mean, it's about education and getting, you know, a consistent message out there. I think that has been one of the biggest things that has created an issue with, you know, again, speaking for America, I mean, not speaking for America, but in an American situation, you know, that there's been so much misinformation, you know, that's gone out about the virus, about contact tracing, you know, privacy issues, you know, I think so. I think education is a big part of that. And I also think, you know, going back to your question, Barbara, about, you know, what do we do? What's the next step after this pandemic? There are going to be more pandemics. I mean, I hate to be the bearer of bad news, but there's going to be something else that is coming down the pipeline. I mean, we had, you know, bird flu, you know, all of these things. I mean, I remember mad cow disease, you know, but, you know, I mean, all of these things are going to continue. And so, unfortunately, COVID-19 is going to turn into the next virus. And how do we, you know, from a US standpoint, how do we approach that in a different way than the way that we've approached COVID-19?
Thank you, Amanda. We have about 2 minutes left, so I'm going to let, since Marco and Amanda just spoke, I'm going to give Laura and Danny each one last minute. And I just want to thank everyone for being part of this. Go ahead, Laura.
I was just going to say that in addition to, you know, a role in advancing good information on the government's part, I'm a lawyer and old school enough to think that the government has a role in passing actual laws. And so there are some pretty decent proposals out there about how data, you know, related to contact tracing could be treated, what could be collected, how, and I think passing a law that people could point to saying, this is how it will be used, this is how it will be used, would actually do a lot to advance the ball here. That it's the absence of any protections and sort of the free-for-all, this device could be collecting anything and whoever's collecting it could be doing anything with it, that creates a lot of distrust. I think a lot would really help.
Thank you, Laura. Danny, half a minute.
Thanks, Barbara. I'll just really quickly say that we're in this new era, as everyone has said, where we have extraordinarily powerful sensing technologies that really can contribute to public health responses. And I do think where federal leadership is probably most important is to develop a view, a policy view, a legal view, as Laura suggested, to make sure we understand what's happening with that data, a strategic view about just how these systems should be deployed and what resources are needed. We've never had this capability before. There's a lot of benefit it can provide. It can also create enormous risk, and this is where we do need, you know, I think federal leadership to kind of set expectations and make sure people are protected.
Great. It's an issue that could go on for another hour, but thank you all for tuning in, and I'm sure there will be opportunities for continuous feedback as we, you know, roll out this brave new world of digital contact tracing apps in the face of our pandemic. Thank you so much for joining us, everyone.
Thank you.
Thanks.
Thank you, everyone. Enjoy the rest of your day.
Thank you.